Hi everybody, my name is Christina Monaco and I am the owner and founder of Bespoke Aesthetics in beautiful West Palm Beach, Florida. And today I have my beautiful patient. I'm really excited to talk to you guys about a very, very well-known procedure that is taking over not only social media, but my entire office. People are obsessed with skin health right now, and we're going to be doing a treatment with microneedling and exosomes. So my beautiful patient has her numbing cream on right now, and that's why it looks a little shiny, but we do numb, for at least 20 minutes or so before the treatment. So what exactly is microneedling with exosomes, and who's the right candidate for it, and what does it treat? We're gonna get into all of that. So one of the things that we spoke about was, what is your concern? Like, what's going on with your skin? She has absolutely gorgeous skin. She is a very well-known influencer. She does a lot of content all of the time. So she's constantly wearing makeup, going in front of a camera with lighting. So we really want to focus on giving that beautiful glass skin appearance. And microneedling with exosomes is a perfect treatment for that. So we're gonna focus today on treating a couple of different things. So microneedling is a treatment that uses a microneedling pen. There are several different ones out on the market, but a microneedling pen that has a disposable microneedling tip. On that tip, there are several microneedling needles that cause little perforations in the skin. And on the pen, there are ways that we can change the depths of those needles. And the reason why that's important is because we want to make sure that in certain areas, we're getting to depth where we can stimulate collagen. It's all about the collagen. It's all about creating healthy skin. And we know that one of the ways that we age on the outside is when we lose collagen. And when we lose collagen, we notice that we have skin laxity. We notice that fine lines and wrinkles start to form. And we were talking before, she has beautiful skin and she has very nice angles. That's another thing that we look at when we talk about the aging process. We look at the patient and I say to myself, what does their bony structure look like? Like, how does their chin, their cheekbones, their eyebrow bones, how does that look? Are they dull? Is everything kind of hanging, or is it nice and lifted with a really nice shape? And she has a beautiful shape. One of the things that we were talking about that concerns her are the lines that are starting to form around the mouth. And we also spoke about how she's just not ready to do any non-invasive procedures with hyaluronic acid filler just yet. So what are the alternatives? The alternatives are using treatments like microneedling that are going to stimulate healthy collagen, that's going to reduce fine lines, wrinkles. It's going to help shrink pores. It could help create that cell turnover. It does help with hyperpigmentation, that we have a little pigment here on the cheeks. It will help to stimulate collagen for the under eyes when patients complain of like hollowness or that they look or feel tired, so it can help with that. Another thing too, you can notice she has some numbing on her neck. So we're going to focus on the horizontal lines. We call them necklace lines or tech neck. Being in the social media era that we're in, we're constantly looking down, we're constantly on our phones. So we have seen this increase in what we call tech neck or in these horizontal lines. So not only should we be using great medical grade skincare, but we want to make sure that we're doing treatments not just on the face, but also on the neck. Another reason why we're doing this is because over time, she has developed what we call post-inflammatory pigmentation or post-inflammatory erythema. And this is a very common skin concern that patients have if they have had acne breakouts. When the acne sits on the skin too long, we'll notice that it can cause that inflammatory response. And when that happens, we get these little dark marks. She doesn't really have significant pitting or significant scarring, but along this area, there's just a few little spots that can look like it's scarring, but in reality, it's just some of that post-inflammatory pigment and redness that we're seeing. And the same thing on this side. So really what we're focusing on and why we're doing this is for the lines around her mouth, the pore size, the texture. And another thing that we spoke about was the start of these like little perioral lines, the lines that are starting to go around the mouth. She's young. She was never a smoker, right? You never were a smoker. And so the reason for them, it could just be years of sun exposure. Obviously, we live in Florida. She was born out in California, so she has had years of just being outside, and that sun exposure has caused collagen breakdown, and now we're starting to notice the effects with fine lines and wrinkles. So one last thing that I should mention that everybody wants to know about, and I get asked about this all the time, is what exactly are exosomes? So we're not just going to use the microneedling pen over dry, bare skin. We're going to use exosomes not only as a glide, but also what I said earlier is that this microneedling pen is going to cause little tiny perforations in the skin. We want those perforations open. We want that to happen so that the exosomes can go into the skin and penetrate and be absorbed, and that's how we're going to have even more of that collagen stimulation. There are several different types of exosomes, and all exosomes really are messengers that tell the cells what exactly they should be doing. And in this case, it's going to say, hey, we want you to build collagen, we want you to get rid of wrinkles, we want you to help tighten the skin, we want you to reduce pore size. And the best way to get the maximum result is to do at least 3 sessions. So patients are doing 3 sessions every 4 weeks. So we're gonna do one today, we're gonna follow up in 4 weeks, we're going to go through the whole journey and have before and after photos, of course. But what's really important to understand is that right now we want to make sure that patients, especially here at Bespoke Aesthetics, that they are getting an outstanding treatment result. So patients will ask me, well, what about the PRP? Like, I've had my blood drawn and I've used it with microneedling before. That was great when I was a physician assistant doing this probably 7 or 8 years ago. Now we have science, technology, all of these things that have evolved, and that's why here at Bespoke Aesthetics, we are using exosomes with microneedling to create healthy, beautiful, glowing skin.
Oh my gosh, it wasn't even that painful, but I'm really red.
Yes, so definitely after doing a microneedling treatment, you're going to be red, and the redness is going to last for maybe like 24 hours or so. We're going to send you home with some post-care information. Also, doing post-care, like with certain types of topical treatments, is really important afterward. But you'll notice is that the face will feel tight, it will feel dry, you'll notice that it's red, you may have like some little broken blood vessels for a couple of days. All of that is normal. It's going to go down. No steam room, no sauna, no jacuzzis, no pools for at least 48 hours, because from the microneedling, the pores are going to be open, so we don't want any bacteria getting in there. No makeup for 48 hours. Obviously, when you start wearing makeup, make sure your makeup brushes are clean. We don't want any bacteria on the skin, especially right after the treatment. Make sure you're washing your face like normal. I want you to do that tonight when you get home, and then when you go home after washing your face, we're gonna have you use some topical products to use for post-care that are going to help calm this all down. And you're gonna notice we did all under your eyes, the upper lip, the neck. That's why it looks red from the microneedling, but it's gonna be perfect afterward.
Can't wait to see the results.
Yay, I'm so excited.
Thank you.
You're welcome, honey.